So this is my head to toe assessment checkoff video. Um, First and foremost, you want to make sure that you've got the order for the head to toe assessment, and you're going to check that before you come in to the patient's room to do that. So first thing I'm going to do, as I'm coming in, I'm going to shut the door behind me to provide for privacy, possibly close a curtain if it's needed, come in, wash my hands, introduce myself to the patient. Hi, Mr. Berry. My name is Jordan. I'm going to be in here for a few moments, just doing a head-to-toe assessment on you, checking different body systems, and I'll probably stay after to chart. So I also am going to gather my supplies and my equipment. The only things I'm really going to need for this are a stethoscope, a pen light, maybe a pen to use to document, and then also when you're coming in, ask the patient name and date of birth, which I'll demonstrate here in a moment. Those are the two patient identifiers that are used the most frequently to identify the patient and are the most accurate. Okay, Mr. Berry, before we get started, can you tell me your name and your date of birth? Okay, perfect. So, um, can you tell me what day it is? Perfect. Um, do you know where you're at right now? Okay, awesome. Can you tell me who the president of the United States is? I know it's hard telling with everything going on. Trust me. Um, so also while I'm doing my assessment, I'm noting his general appearance. What's his hygiene like? Um, we're also noting his posture, which he's sitting up in the bed. He's probably at less than a 30-degree angle. We could always try propping him up too. Um, you also want to know um, grooming. Is he well kept? What medical supplies at the bedside is he using? Maybe he's got some oxygen that he's wearing. Maybe he's got IVs running. Um, yeah. Is there any walkers, canes, scooters at the bedside that he might be utilizing as well? All right. So I'm just going to start by doing a little bit of a neuro assessment on you. When you're doing the neuro assessment and you're talking to him, that's the best time to assess his mood and his effect. Mr. Berry seems like he's in, a positive mood today. I'm not noticing any flat effect with him, so we can document that as such. Um, so I'm just going to start, Mr. Berry, by testing your memory a little bit. Um, I'm going to repeat 3 different numbers, just random numbers, and then I want you to wait. I want you to say them back to me, and that's how we'll test your memory. So the numbers I'm going to give you are 3, 5, and 7. Okay, perfect. Keep those in mind because we're going to come back to those. So we're going to start by testing his upper extremity coordination. So we're going to start by doing some ROM. Can you lift your arm up like this for me? Perfect. Can you kind of move it like this in a circle? Awesome. Can you kind of put your arm out like this? Perfect. Now let's test with the other arm. Moving your arm up, putting it in a circle, and flipping it over. Awesome, Mr. Berry. So then we're going to test, same thing with your lower extremity. We're just going to do some ROM. Perfect. So let's start by kind of doing, by testing your sensation with some light touch and some sharp touch. So I'm going to have you close your eyes for me. I'm going to press down on your arm just a little bit. And can you tell me if that's light, dull, or sharp? Light, okay. Light, perfect. Yep. All right, let's try something, a different type of sensation. Oh yeah, sharp, huh? Mhm. Yeah, sharp. Yep. And same thing. You got it. So starting from the head, we're gonna assess face symmetry, shape. Maybe I'll just palpate to see if I can feel any swollen lymph nodes. Perfect. And then you're noting the hair as well. Maybe you're checking the scalp to see if there's any abrasions, lesions, um, dry patches, maybe some parasites, lice. I don't know, maybe. Um, so we're just gonna move the neck a little bit. Major motion of the neck. Here you can palpate the neck, and maybe you can palpate carotid arteries as well. Also, you're going to know any jugular vein distension, which I'm not noting any on Mr. Berry. So then we're going to move to your eyes. So you want to know if there's any drooping or sagging of the eyes, also with face symmetry as well. And maybe if you had a patient who had a stroke, you would notice some asymmetrical drooping, but that's not why Mr. Berry's here today, so we don't have to worry about that. I'm not noticing any, so we're good there. So I'm just going to look into the eyes. So while I'm doing this, I want to note the color of Mr. Berry's eyes. What does a sclera look like? Is it white? Maybe it's yellow. Maybe it's reddened or irritated. So that's something important that we do want to know. Noting any inflammation. What does the conjunctiva look like? Is that inflamed? We're inspecting each iris. While we're doing the pupil assessment, we're noting, are the pupils reactive? Are they sluggish? What's the size of the pupil? What's the shape? In practice, I've noticed some patients who have had a stroke, maybe their pupils aren't reactive, or they aren't the same size when they react. I've even had patients who, some of them have like very strange shapes to their pupil because of the stroke. And then checking if they're symmetrical, checking the alignment. So now we're going to move on to the nose. So I'm just going to look inside your nose, Mr. Berry. Perfect. So same thing with the nose. We want to know the symmetry, shape. Is the septum midline? Is there any drainage coming from the nose? If there is any drainage coming from the nose, what does it look like? Thin, thick, yellow, green, clear, because those different colors and those different consistencies can indicate different things. And so we're just checking to also see what the nasal mucosa looks like. Is it pink? Is it moist? Is it intact? If there's any dryness or irritation, you would want to note that. And then we also want to check the patency of the nares. So I'm going to have Mr. Berry close one and breathe through the other. All right, I'm going to close one of your noses, one of your nostrils, and then I'll just have you breathe in for me. Perfect. And then lastly, we're just going to check his ears. So with the ears, you want to pull the pinna back and down and just look inside. So while we're looking in the ears, we want to note the placement, um, what the skin around them looks like, if there's any discharge coming from them, what that discharge looks like, um, and if there's any tenderness when pulling the peanut down, that could indicate something as well. And then lastly, you just want to look in their mouth. When looking in their mouth, you just want to know the color of their teeth. Do they have any broken teeth? Do they have any missing teeth? What do their gums look like? Are they moist, pink, and intact? Sorry. If there's any discoloration, um, maybe Mr. Berry has dentures. Maybe he has some type of a plate. Maybe he has cavities. Those are all things that you want to know and document in your HEENT. So, moving on, we are going to do a respiratory assessment. So I'm going to listen to various places on the front of Mr. Berry, and then I'll listen to him on the back as well. When you're listening to him, you want to know the symmetry of the thorax, what his chest expansion is like. Is he having dyspnea on exertion? Maybe he's having dyspnea on insertion. What do the lung sounds sound like? And then, is he using his accessory muscles? So I'm going to listen, and then I'll verbalize my findings, and then I'll go ahead and palpate some different areas where the lungs are at. So for the most part, Mr. Berry is clear. However, I did notice a little bit in his bases bilaterally that his lung sounds are clear and diminished, but I don't feel that that's something that we need to be concerned about at this time. So moving on, like I said while I was doing my assessment, noting symmetry, noting accessory muscles, exertion, yeah, just various things. So moving on to the cardiac assessment. We're going to listen first to his carotid artery. When listening to the carotid artery, you want to make sure that you're not using this side of your stethoscope. You want to twist it around and use the bell. So while listening to the carotid artery, didn't notice any bruits. So everything sounded normal. I did go ahead and listen to the apical pulse as well. I didn't notice any adventitious heart sounds, so we're good there. So next step would be going to assess pulses. So the various pulses that we are going to assess, are the brachial, while you're assessing pulses, it's important just to make sure that you're going back and forth from the left and the right sides, just so you're having a comparison between the two. Um, Checking the femoral. Checking the popliteal. Checking the tibial. And the pedal. So with all of Mr. Berry's pulses going from the brachial to the pedal, plus twos, I didn't notice any abnormalities. He's got a strong pulse. Um, it's not bounding. It's just right where it needs to be. So moving on, we're just going to assess the abdomen. With the abdomen also we're going to note symmetry. We're noting if there's any skin issues. Maybe he's got some bruising from heparin injections. Maybe he's got scars or lacerations. Scars can note different types of surgical procedures depending on where they're located at. So we're just going to note that. So first things first, we want to auscultate all four quadrants, noting the vowel sounds. So we've assessed all four quadrants, assessing the abdominal aorta, no bruise in the abdominal aorta. All vowel sounds are active and audible times 4 quads, so we don't need to be concerned about that. So we're just going to go ahead and palpate in all 4 quadrants. To feel for any masses, maybe feel for any umbilical hernias, which it could be that if there is a hernia, you might just be able to see it depending on how big the hernia is. When you're doing your assessment and you're just looking at his skin, but sometimes you might have to palpate to be able to feel that. So next thing we're going to do is the musculoskeletal assessment. So if Mr. Berry, since Mr. Berry's in bed right now, we might wait to check to see how he does with his gait, if he has a sturdy gait, if it's symmetrical, until we actually get up to walk him to maybe like the bathroom or something, or if he gets up to start working with physical and occupational therapies. We can wait for that. So with testing limb strength, I'm going to have Mr. Berry put his arms out for me, and I'm going to say, don't let me push your arm down. Okay, Mr. Berry, I'm going to have you extend your arm for me. Don't let me push down. Okay, and then don't let me push up. Perfect. Same with this one. Perfect. So with his legs, I'm going to have you pull up on my hands. Perfect. And then push down like a gas pedal. Awesome. And also while you're doing your musculoskeletal assessment and he's in his gown, you can kind of start doing your integumentary assessment as well. So with that, we just want to be, we're feeling the skin, we're palpating for texture, moisture. His skin is intact and dry. I'm not noting any moisture. No edema in his upper extremities that I'm noting. We can check the skin turgor as well. He has good skin turgor. We can assess any abdominal or any skin folds, maybe under his armpits for redness. We can pull up on his belly while we're doing our abdominal assessment, checking under the skin folds for any redness, irritation. Maybe depending on how big your person is, there might be some moisture under those skin folds. We're also going to check the capillary refill. So you just want to pull down on the thumb and the fingers. And the ARB blanchable refill time is less than 3 seconds, so that is what we're looking for. Same thing with the toes. Bilateral lower extremities, you're noting the same things, the skin's color, texture, moisture. I'm not noticing any moisture issues. Skin is clean, dry, and intact. However, he does, in his bilateral lower extremities, ankles and feet, I'm noticing some +1 edema. So we'll just, when we're doing our documentation, we'll go ahead and document that. So, with our musculoskeletal assessment, I'm going to prompt Mr. Berry to kind of roll on his side for me, making sure that you're keeping your patient comfortable. We are just going to run our hand on the back of his spine. You want to note the curvature of the spine. Maybe the patient in the past has had some scoliosis going on, or we just want to make sure that the spine is in alignment. We're also going to palpate down the spine. And this is a good time in your skin assessment also to know what the back of the patients look like. Is there any lesions, abrasions, moisture? Is skin clean, dry, intact? You can check their bottom too to know any redness. If your patient is sitting on their bottom a lot, or they're on a bed rest protocol, you might want to maybe do some intervention, like maybe a Mepilex dressing on their coccyx, just to prevent any bed sores from happening. So, lastly, with the assessment, you want to note the presence of maybe a urinary device, or maybe if the patient had some sort of ileostomy. You want to note the color, odor, character, and amount of the urine. And if your patient doesn't have anything that obviously tells you, or they're pretty independent as far as them being in the hospital, you can simply ask them, did you have bowel movement today? Well, what does your bowel movement look like? Or the last time you urinated, what did it look like? Or maybe if they're using a urinal, or maybe a hat of some sort, you'll just be able to go in and visualize that yourself. And then also, is there any pain associated with urination? Is there an odor? Is it burning? And also, overall, you just want to assess your patient's pain level in general as part of your assessment. So, with that, I'm going to end my assessment. I'm going to make sure that when I leave, my patient is in a comfortable position, have the side rails up if needed. Make sure that they have their call light, water, cell phone, anything that they're going to need. Maybe undo the curtain, ask them if they want the door opened or closed. Make sure it's in the lowest position. Make sure that the bed is locked. And that's it. And then when you're done, you can document your findings. I think it's always best if you stay at the bedside and document your findings. That way, if you forgot something or you're unsure about something, you can go back and recess because your patient is there. So that is it. That is my head to toe assessment.